Okay, I wanted to go through some common concerns so you guys can screen for yourself, and then we're going to pop over to Georgia. So, common concerns with the pelvic floor is urinary incontinence, constipation or fecal incontinence. This should be together. Apologies for that. Sexual dysfunction, which can be decreased libido, decreased arousal. It can be, man, when I was 20, I had these mind-blowing orgasms, and now that I'm 30, 40, 50, they've changed or maybe they've disappeared. It could be pain with intercourse. You can have back, hip, or abdominal pain and pelvic organ prolapse. So when we think of urinary incontinence, it can be when you cough, sneeze, or laugh. It could also be while you're doing exercises, think running, jumping jacks, any of that. Or you could have urge incontinence where you see the toilet or you think, gosh, I have to go to the bathroom. You're in the back of Target and you're trying to like run to the bathroom and you've left your cart. I've had that happen to me. Constipation or fecal incontinence, this can occur because you're having a discoordination between your tummy and your pelvic floor. Your muscles can be overly tight. Sexual dysfunction, I listed some of these things. It can be as we age or after having kids, our sexual appreciation can decrease. Achieving orgasm can become more challenging. Back, hip, and abdominal pain. Again, we want all of these things to work together. It's not truly about strength. We can even have an increased risk of falling due to a lack of stability through these areas of our body. And finally, pelvic organ prolapse. So you can have incontinence, you could have difficulty voiding, you can have heaviness, sensations of pressure, or a dull ache. So I don't mean to share these to be depressing in any way. I want to give you guys this knowledge so that you can say, Laura, maybe I have some of this stuff. I'm going to go ahead and check my vulva and see if it's moving in the appropriate way. If it isn't moving in the appropriate way, certainly seek help with physical therapy. Get one of the V-Vision mirrors so that you can really visualize that space, because if you don't know what normal is, then it's hard to communicate that to a provider. And know that there are lots of people and companies out there that are here to help you feel your best.
Laura, I just want to just pop in quickly to say it was so helpful. I can see that there's been like a lot of love for the vulva puppet, but it was really, really helpful to see, like, to have an actual like visual reference of like what happens when you go through certain floor exercises. I think that's so valuable.
That is so huge. So again, you might think and feel as we go through this stuff, I think I'm doing it right, but actually being able to look and see that true movement and how much movement is happening. Personally, I have a slightly overly tight pelvic floor, so I don't have a lot of movement. So I know I have to focus on relaxation more than kind of upregulating and strengthening. And that's what pretty much my second to last slide was. Just, it's not all about Kegling. You have to focus on the range of motion with those muscles, coordination, as well as the strength.